Hi, Mark at Fitness for Life, coming to you live on tape. So, what I want to talk about this month, some breathing and the thoracic spine rib cage area. Okay, thoracic spine and the rib cage. Okay, this basically the middle back starting approximately here, coming down to approximately here. So, the thoracic spine is what the ribs are attached to. So it's protective with the ribs, and then it helps protect the internal organs. But what a lot of people don't realize is it's designed to move also. And a lot of people lose mobility in the thoracic spine, which lends itself to all kinds of problems from the neck, to shoulder problems, to breathing problems, to postural problems where you've got the hump in the back or your head is forward. Some of the causes of this are shallow breathing because you've got muscles that are attached up here in the neck that attach to your first and second rib. And if you're shallow breathing, you're constantly working these muscles and you're just getting the upper chest to move up and down. Then these muscles get overworked. Then people say they have pain, tightness in their neck, and it's simply because they're not breathing correctly. These muscles start getting tight, then it can start pulling your head forward. You can start increasing the curve in your upper back, so then you start standing like this. I wish I would have known this 78 years ago, but I'm still working on it now. So you have to have mobility in the thoracic spine. You have to learn to breathe through your nose, inhaling and exhaling, because you want to take air all the way down into your diaphragm. Down here, you want to see all of this slightly expand and contract like a balloon. If you're chest breathing, you can put your hand on your chest, and as you're breathing, you're taking much more shallow breaths. Your hand's going to rise and fall slightly. When you're breathing correctly, air into the nose, air out through the nose, is what it's designed for. You're going to feel a little bit of pressure out and in here. You should breathe light. You should breathe deep and make sure that you pull enough air in that you feel it moving down here. Enough air that when you exhale, that is like deflating a balloon here. But that can help mobilize and work the spine because your ribs actually move also. They're like bucket handles. When you take air in, they rise and fall slightly. Okay? And if you're not working that correctly, like we've said, other areas take a hit. So, two take-home messages today. One is, start learning as much as possible to breathe in and out through your nose, light breaths, but all the way down into your lower abdomen. Part two is you want to maintain and work on thoracic mobility. When you're sitting, your thoracic spine, so this mid part bends back approximately 25 degrees. It bends forward approximately 30 degrees. It bends to the side about 25 degrees, but it rotates about 50 degrees. A lot of the rotation is what we lose. So in these month's videos, we're going to show you 3 different ways of helping to mobilize and get some mobility back in your thoracic spine. If you have further questions, contact us at fitness4life.com.